Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. In this video, we are going to see about autopsies. Autopsy, this forms the major chunk of forensic medicine. Actually, it forms the soul of forensic medicine. So, what exactly is autopsy? So, autopsy is your post-mortem examination. Post-mortem examination means we will examine the body after the death. So, we will examine a person after their death. The dead body examination, we call it as post-mortem examination. And this post-mortem examination, there are a lot of types. And the most common types that we usually do is medico-legal autopsy. That is, autopsy that is done for medico-legal cases. Medico-legal cases means all your injury cases, any accident deaths, any suspicious death, any death in unnatural manner, all those medico-legal cases, we will do this medico-legal autopsy. Then comes the pathological autopsy. This pathological autopsy, it is also known as hospital autopsy. So here what happens is that if you want to know about a disease progression, if you want to know about a pathology, so pathophysiology of a disease, if you want to know about it, you can conduct autopsy. You can conduct autopsy, you can take samples, you can study those samples, you can do microbiological analysis, histological analysis, biochemistry analysis, all sort of analysis you can do. You can do all the imaging studies. Postmortemly, you will be doing all the investigations just to know about the pathophysiology of a particular disease. So, this kind of autopsy is known as pathological autopsy, and this is more academic oriented. So, this is mainly done for your academic orientation. So, these are the main chunk of autopsy that is normally done. Apart from that, you have few different types of autopsy. First one is virtual autopsy. So, virtual autopsy means there will be no incision, only imaging. Like you will be using all sort of imaging techniques, CT, ultrasound, X-rays, all sort of imaging techniques will be used to do autopsy. So, you will image the patient, like you will undergo the body into CT machine, and after that you will be seeing what is the pathology, whether it is a case of any hemorrhage, any pathology present in the heart or any pathology present in any other part of the body. All those things you will be identifying under imaging conditions instead of opening the body. So, this is virtual autopsy and there is no incision, and this is a highly advanced method which requires lot of instruments. So, you need CT machine, you need ultrasound, you need MRI, all sort of high-end machines you need to do this technique. So, this is one technique. Another technique that we have is known as autopsy. So, autopsy, what we usually do is, here we use only ultrasound. Only using the ultrasound, we will be doing the autopsy. So, like how ultrasound abdomen is done, we will be using ultrasound to find out all the conditions. So, this is autopsy. And next what we have is needle autopsy. So, in needle autopsy, you will do ultrasound and you will take samples. So, you will do ultrasound guided sampling. So, this is ultrasound guided sampling. So, blood if you need, you will guide the ultrasound and you will pierce the heart or any blood vessel and you will remove blood. And if you want liver sample, using the ultrasound, through the ultrasound guidance, you will take out the liver sample. Likewise, all sample that you need, you will be taking them out via this minimal incision. Okay, this is needle autopsy or minimally invasive autopsy. We call it as minimally invasive autopsy. So, these are the few non-invasive and minimally invasive autopsies that has been followed. But major chunk of the autopsy that we do is a full complete invasive autopsy. So, it is an invasive complete autopsy, and that too medico-legal autopsy is what commonly followed. And this pathological autopsy, to some extent, it is also being done mainly for the academic purposes. To know about the pathophysiology of the disease, we do this pathological autopsy. So, these are the main types of autopsy that we have to know. Apart from that, there is one more term known as obscure or negative autopsy. So what this obscure negative autopsy means, you have done all investigations. You have done all investigations, as in like histopathology you have done, microbiology you have done, all biochemistry tests you have done, you have sent the samples for toxicological analysis also. Even after thorough investigation, even after all proper thorough investigation done in a perfect manner, there will be no cause of death identified. So no cause of death was identified. So this kind of autopsies, we label them as negative autopsy. This is mainly means the cause of death is concealed, it is obscured by some sort of condition. So because of that, we are not able to identify the exact cause of death. So these kind of autopsy, this is commonly seen with certain condition. For example, concealed traumas. Like these concealed trauma, this is very common. Like concussion, it is very common nowadays. People, they will have very trivial injury or sometimes major injury also, but externally or organically you won't be able to find out any difference in them. But still they will suffer from concussion and they will suddenly die. In such cases, if you do autopsy, even after doing histopathological examination, you won't be able to find out any changes. So if you don't have the proper history, if you only get the body, if you look at all the examinations, still you will get nothing. So these kind of autopsy, these kind of concealed traumas, it will give us nothing. So we call such autopsy as negative autopsy. This is something different from a defective autopsy. Like sometimes you won't get the cause of death even a normal case because your system was defective, your mode of doing the autopsy was defective, or sample collection and analysis was defective. If something is defective, we call it as defective autopsy. Defective autopsy is, you have something faulty, so it is mostly a faulty technique. So there has to be some fault in the technique whether used or the analysis that you have done. So some sort of fault have to be there to call something as a defective autopsy. But even after doing everything perfectly, you are still getting a negative result. That means you are not getting any cause of death, means that is a negative or obscure autopsy. And these negative autopsy, it is commonly seen in concealed traumas like concussion. Commotio cordis means there will be a blunt trauma to the chest. Blunt trauma to the chest, especially over the heart region. So over the cardiac region, there will be some blunt trauma, and especially in contact sports, this is very common. So there will be some blunt trauma over the chest and people, they will suddenly die. And in such cases, you won't be getting to see any changes. Even if something had happened like a very early myocardial infarction, if the patient is dying instantaneously, you won't be able to identify any changes. It will take a minimum of 3 hours to have some meaningful change in the body. So before, if something happens instantaneously, you won't be able to identify any changes in all the technique of autopsy. So such kind of autopsy will be labeled as negative autopsy. Few example, railway spine. This is a spinal concussion. Like how the brain is concussed, here the spine will undergo concussion and there will be death. And vagal inhibition, which is a very important phenomenon, like this vagal inhibition, this will be dealt in lot of conditions. They will say like simply vagal inhibition of heart happened, like that they will say. So what exactly is this vagal inhibition? So this vagal inhibition, how it occurs is, this is mainly due to the activation of the baroreceptors. So activation of the baroreceptors. Any pressure to the neck structures, the carotid body in the carotid sinus will get activated. So any baro changes, barotrauma, any baroreceptor activating signals is happening, the carotid body and carotid sinus, it will get activated, and via the herring nerve, this herring nerve, it will conduct this, it will transmit the signal to the glossopharyngeal nerve. So from the carotid body, the herring nerve will take the signal towards the glossopharyngeal nerve, and from there the signal will go to medulla, and from medulla there will be activation of the vagus. So the medulla, the tractus solitarius, there will be activation of the vagus nerve. So vagus nerve, when it get activated, what it will do is, it will go inhibit the heart. So it will reduce your heart rate, all your cardiac activity. It will be reduced by this vagal stimulation. Actually what happens is that vagal will be stimulated, and that vagus action is inhibition of heart. So we just combine everything and we say vagal inhibition. It is actually not the vagus getting inhibited. The vagus, it is inhibiting the gut by getting stimulated by these glossopharyngeal nerves impulse. Clear? So baroreceptors, it will get activated via hearing nerves. It will send signal to the glossopharyngeal nerve, which will go to the medulla, and in medulla the vagal stimulation will happen, and stimulation of vagus will result in the inhibition of heart. So this is the actual pathway. How this vagal inhibition works is like this, and this vagal inhibition, it is seen in a lot of unnatural deaths, sudden deaths especially. So in this hanging also we said, drowning also we said. In a lot of cases what will happen is that anything to the neck, any abnormal stimuli to the neck, sometimes it will be very trivial. People with more sensitive receptors, those get activated and they will end up dying. So this vagal inhibition is something very important in forensic medicine, and this is the reason for lot of sudden death, and in these cases we won't be able to identify anything. Postmortemly, no matter what investigation we do, nothing will be there. So this is one such important condition which gives negative autopsy. Next, cardiac conditions. So cardiac deaths are the most big chunk of the sudden deaths, especially which will result in negative autopsy. For example, if there is any spasm in the coronary arteries, like spasm of coronary arteries, they will undergo a spasm, and after sometimes it will go back to normal. So because of this arterial spasm, there will be myocardial infarction and the patient will die. So they would have died of cardiac arrest, but because the spasm, it reversed itself on its own. When you do the autopsy, you won't be able to see anything. There won't be any plaque, there won't be anything significant like emboli, thrombi, nothing will be there. Simple, the artery would be seen very healthy, but still the patient would have died. So these kind of cardiac condition, it is also possible for giving negative autopsy. So it is spasm of coronary artery, Wolff-Parkinson-White syndrome, Brugada syndrome. All these can cause negative autopsy. And endocrine dysfunction, especially untreated or uncontrolled diabetes. Untreated or uncontrolled diabetes, they can easily end up with ketoacidosis, right? So diabetic ketoacidosis, they can easily end up and the patient will suddenly die. And in few cases, you won't be able to identify the acidic imbalance in the dead bodies. So these ketoacidosis, they can cause death. If there is any hyperinsulinemia condition, it can result in hypoglycemia. There also death is possible. So these kind of sudden conditions like ketoacidosis, acidic changes, hyperinsulinemia causing hypoglycemia, all these endocrine dysfunction, any cortisol or storm, all those things can result in sudden death, can also cause negative autopsy. So when you get a negative autopsy, first thing that you have to ensure is whether we have done everything right or not, whether we have done anything wrong. That thing we have to find out. If we have done everything properly, then we have to go to the history. Verbal autopsy would be more useful. So we have verbal or psychological autopsy. Once your autopsy does not give any result, all other analysis is also giving no result, then the only thing that we are left to do is this verbal or psychological autopsy. You will go them, ask for history, you will ask for any recent medical history, like family medical history, all those activities, every history you will ask for them, and you will try to come to a conclusion. So this history is the main thing that will give a clue in these circumstances. Even in case of electrocution, what will happen is, if nobody knows, like if nobody had seen an exact scene, crime scene, if it is not analyzed properly, electrocution, sometimes there will not be any entry or exit wound and the patient would have died. you will not be able to identify any changes, and without knowing the history, you won't be able to come to this electrocution diagnosis. Only if you have the history, you can at least exclude all other possible causes and come to the conclusion of the electrocution. If you don't know the history, here it has to be called a negative autopsy only. So history is very, very important under these circumstances. This is why an autopsy always starts with history taking. So when you get the autopsy requisition from the investigating officer, he would have given his brief account, like what happened, how the body was found, how was the crime scene, and what was the history, what if there is any medical history and all, that would have also been mentioned in the Panchnama. And without reading all these and without going to the patient's attendant, like the deceased attendant, you have to go and find out his relevant medical history, the recent history, what happened before his death and how he was found dead and what is the crime scene. All those things you have to get an idea about. Only after getting an idea, you can go into the autopsy room, because there are multiple causes of death, right? So to narrow it down, you need to have the history. History is very, very important during autopsy. Like how you treat people, for autopsy also, history plays an important role. So these are the important types of autopsy that we have to know. Now we are coming to the main autopsy, that is your medico-legal autopsy. I told you we do pathological autopsy to know about the pathophysiology of a disease, more an academic orientation. That is why we do pathological autopsy. Now, why we do medico-legal autopsy? That is also important, right? So just because the IO is asking us to do autopsy, we are not doing autopsy. We are doing autopsy to find out certain things. So what are those things? So what is the important thing that you find out by autopsy? So the first foremost thing that you do medico-legal autopsy is to find out the cause of death. So cause of death is the first and foremost reason for doing an autopsy, because when investigating officer, when they go and don't find any cause of death, then only they will ask for autopsy, right? So the primary motive for doing the autopsy is to find out the cause of death. That is first thing. Next thing what they will ask for is the time since death. What is the time since death? And next thing would be manner of. So these three are very, very important. Without giving answer for these three, your autopsy report is incomplete. And these three forms the crux of autopsy report. So in autopsy report, in opinion column, these three things will definitely be mentioned. These three forms the main part of your autopsy report opinion. And apart from that, what is required in a medico-legal autopsy is that you have to be able to identify. So if it is an unknown body, you should be able to do some sort of identification, or at least preserve something for identification. Like you have to preserve some DNA sample, like you have to preserve bone marrow or blood, whatever that is available, which would be a best source for finding out the DNA, you have to preserve it. So if the person is known, there is no issue. If he is unknown, this identification comes important. Sometimes you will be getting only bones, or sometimes you will be getting dead body which is like in an advanced state of decomposition. Under such cases, you have to do identification. You have to know whether what is the sex of the body, what is the probable age of the body, and what is the race. All those identification, gross identification feature, you should be able to tell the investigation officer. So this identification is very important if it is an unknown body. Next to that, what they will expect from you is about an injury details. So if there is any injury over them, they will expect to know about the nature of the injury, like how it was inflicted, whether it was a self-inflicted wound, or someone had assaulted them, or what kind of weapon could have caused that injury, like how that injury happened. All that will be expected of you. So if you find an injury, they will ask you whether it is a stab wound or whether it is a firearm wound, whether it is a blunt trauma, sharp trauma. All those things will be expected of you. So you have to tell them the exact details about the injury. What was the manner of infliction? what was the nature of the weapon that could have inflicted the wound, and what would be the age of wound, whether it is a fresh wound or it is a very old wound or recent wound, something like that they will be expecting of you. So this injury details is also very, very important. And one more final thing is that they will expect you to analysis of sample and preservation. Sometimes we will be suspecting some poison death, right? So in those cases, they will ask you to preserve the sample to send it for toxicological analysis. So this toxicological analysis, sample preservation, and histopathological analysis, sample preservation, biochemistry analysis, sample preservation, everything is needed in a medico-legal autopsy. And also, if it is an unidentified body, we have to preserve their dress, ornaments, and possession. So all those things you have to preserve, and the sample preservation, it will be requested by the IO himself. And if you think like something need to be preserved apart from what has been asked, you can preserve things. So if you think that bile has to be preserved, the police is asking only for blood, and if you think that bile preservation would be much better in this case, you can definitely preserve. Whichever you seem to think that would be perfect for this case, you can preserve. So these things, all these things is expected to be done in a medico-legal autopsy. And if it is a medico-legal autopsy, the only thing that you need is the IO requisition for PM, not consent of relative. Like if a relative is saying, I don't want autopsy to be done on my husband, like if it is a wife, they can say like, I don't want autopsy to be done on my husband. They are the legal guardian, right? The person is dead, they cannot give consent. So next to that person who can give valid consent would be his wife, spouse, right? So if they are not giving consent, you cannot say that I will not do autopsy since I am not getting any consent from the spouse. But the thing is that if it is a medico-legal autopsy, this is something ordered by the law, something ordered by the judge. So you have to do autopsy if there is requisition from the investigating officer. Without any consent, you can do a medico-legal autopsy. That is the main thing. And this medico-legal autopsy should always be a complete autopsy. Meaning, if someone is giving a history of sudden death, but you know that by history, medical history, that it could be a case of myocardial infarction. So you are expecting myocardial infarction changes in that body. So you directly open the heart and you find out some myocardial changes, like ischemic changes you are finding in the myocardium, and also in the coronary arteries you are finding some thrombi. So now your cause of death is clear. So you can simply close the body and go away, right? No, it is not right. What you have to do is, even if you have found out the cause of death, you have to do complete autopsy. You have to open all the cavities, you have to examine all the organs, and then only you can close the body. So this complete autopsy should be done in all medico-legal cases, and it should be done only in daytime. It should be done only in daytime, and if doing at night, there are few exceptions. Only for few cases we can do night autopsy. Usually it is done only during the day, but for few cases it can be done at night. One example is organ donation. If some MLC case, like if some brain dead case because of RTA, if someone is dying due to some road traffic accident and they are like brain dead and they want to donate their body, they want to donate some organs to someone else, what we have to do? It is an MLC case, right? MLC, we have to do autopsy. Autopsy is mandatory. We cannot just forego autopsy in such cases. We have to do autopsy, but the organ of interest, if they are donating the liver, we should not dissect the liver. We have to simply do inspection, whether anything is abnormal with the liver or not. We will simply do inspection and we will do autopsy and all other organs, and we will leave the liver. And once we complete the autopsy, right away in the OT, they will take the case for donation purposes. So under such cases, we can do night autopsy. You don't have to wait till the morning. So if someone is dying at 10 in the night, you don't have to wait till 10 in the morning for doing the autopsy. You can right away do night autopsy, and preserve the organ, because that timing, that molecular death timing is very important for organ donation. So you can do night autopsy for organ donation cases. And if there is any law and order issue, there is any big law and order issue, if it is a rape or murder or something and some very big law and order issue is coming up, under such cases you can do night autopsy. Otherwise night autopsy is completely banned. But the priority is given only for this organ donation, and this law and order issue, this is very rarely done. This will done only after due consideration of the situation. So if they ask you for which case you will do night autopsy, you can always say that it is for organ donation, and all other cases we will be doing during daytime only. So these are the important things that we have to know in medico-legal autopsy. And next what we have is pathological autopsy. So pathological autopsy. So pathological autopsy, like I already told you, we do it mainly for the pathophysiology of the disease. And this is usually done by a pathologist. And this is done at the hospital. And what happens is that here the consent of relative, consent of the legal guardian is must. It is very important. Without their consent, you cannot do autopsy. In medico-legal autopsy, all you needed was PM requisition from the investigating officer. But here in pathological autopsy, consent is must. Without consent, you cannot proceed to do pathological autopsy. And this autopsy, it can be done at any time. And this can be an incomplete autopsy also. Like if you have some organ of interest, if you want to see the COVID lung changes, you can only do lung autopsy. Like you will just open the thoracic cavity, examine the lung, take out sample, and you can simply close the body. It does not mean you have to open all, like you don't have to do a complete autopsy. Whichever is your organ of interest, you can simply do that. But it is preferable to do complete autopsy if you want to know the exact pathophysiology. So it can be incomplete, not necessarily like it is an incomplete autopsy, but it can be an incomplete autopsy. And one important difference between these two is that the cause of death. The cause of death and the changes, here it will be communicated to the relatives. Especially if they find something very serious, like something that could be genetic, something that can affect the family members. If they find out something, it will be communicated to the relative. But in case of medico-legal autopsy, it is not communicated. So the cause of death, it is not communicated, and also the body after autopsy, it is handed over to investigation officer. We don't give it to the relative directly. We will hand it over to the investigating officer, and they only give it to the relative, and you will tell the cause of death to the investigating officer only, not to the family member. So these are the important things, important differences between a medico-legal autopsy and a pathological autopsy. So this is the primary introduction that we need to know before going to do an autopsy, whether it is a medico-legal autopsy or pathological autopsy, or what type of autopsy we are going to do, whether we are going to do a virtual autopsy or autopsy, or we are going to do a minimally invasive autopsy, or we are going to do a verbal psychological autopsy. So these verbal autopsies and all, this is especially useful in countries where low socio-economical countries, where we can do these autopsies, like the consent for doing pathological autopsy cannot be given by few people. So under such circumstances, and if you don't have much resources to conduct all sort of tests, but if you want to have at least some sort of idea about the condition, you can at least do verbal autopsy, if not very extensive pathological autopsy. So this verbal autopsy and psychological autopsy, they are also important in their own way. So this is the basic thing about the types of autopsy. So with this, we have completed the introduction to autopsy and a basic knowledge about autopsy. I hope I have provided, and thank you for watching.